In this video, we will go over most of the possibilities as to why teeth might become sensitive or painful after a filling is done. When talking about any pain, we talk about the different possible mechanisms or pathways of pain, and then how a filling may have triggered those mechanisms. Only then can we understand the different remedies. Before I start, I want you to know I will address 3 questions you'd likely have throughout this video as well. First, did your dentist do anything wrong? Second, will your tooth eventually feel better? Third, was this necessary when now my tooth hurts and it didn't hurt before the filling? I am Rick Buck and I've been a dentist for 15 years, so like and subscribe if you have teeth. A quick disclaimer, I am doing this video to answer the online question, not because I have a big problem with this at my practice. Okay, here are the questions we need answered about tooth pain after we've done a filling. First, is the tooth sensitive to cold? How long does that last, and how severely is it to the cold? Second, is the pain you are having to biting or chewing? Third, does the tooth throb on its own? Fourth, are you catching a lot of food where the filling was just done? Fifth, does your bite feel uneven or off, or like you're biting on that tooth first since the filling was done? Now this is all going somewhere, so stay with me. Now then, let's talk about the different tooth pain mechanisms that might have happened because you had a filling done. And the first one we'll start off with is pulpitis. Pulpitis is the inflammation of the pulp chamber in the center of your tooth where its main nerve system lies. If the tooth experiences inflammation in that center nerve canal, it also changes how the nerve reacts to normal stimulus or stimuli, and it makes them more excitable or easily triggered and can cause pain, especially when cold touches the tooth. Also, if cold touches that tooth, it can also further constrict the tooth, and that increases the pressure, and that can cause pain too. If the cold sensitivity is a short duration, normally less than 10 seconds, then pulpitis is said to be possibly reversible, meaning the tooth may possibly heal itself and the pulpitis will go away and back to being normal on its own. However, teeth are not as good as healing than other parts of your body, so sometimes the pulpitis won't heal at all, and it'll get worse until the tooth eventually dies, which then turns into a breeding ground for a bacteria and infection in that center canal where the nerve once was. We determine if a tooth has irreversible pulpitis if cold sensitivity tests last longer than 10 seconds, about. A dentist can also determine if a tooth is dead with a pulp vitality tester. Here's the thing, anytime you get reversible pulpitis, it can get better, but it can also progress and turn into irreversible pulpitis. Luckily, I will tell you what I have my patients do to hopefully stop this progression in just a second. So what does pulpitis have to do with having a filling? First, you may have noticed that as your dentist was drilling for the filling, he was using a drill with tons of water spraying out of it. This is for many reasons, but the main reason is to keep the tooth cool. Why? Because if the tooth heats up too much as the dentist is drilling, this will elicit inflammation in your tooth. So if your dentist wasn't using water or enough water, then it could have caused pulpitis. But even if they did use sufficient water, the tooth can still heat up too much anyway. The chances are they used enough water and you were unlucky if this is what happened to you. You see, pulpitis isn't only caused by heat because your teeth can sense trauma in other ways. So drilling in general can cause pulpitis. The deeper the cavity, the more likely your tooth will sense trauma causing pulpitis. Here's my trick that I have my patients do that hopefully prevents pulpitis from progressing to irreversible. I do this on any patient that comes to me that I think might have sensitivity after a filling. What I do is I have the patients take over-the-counter ibuprofen 3 times a day for 3 days with the recommended dose on the bottle, normally about 400 milligrams. Here, ibuprofen is not for the pain, but for the anti-inflammatory properties, although getting rid of the pain is good too. I rarely ever have reversible pulpitis advance to irreversible pulpitis because of this trick. For patients that can't tolerate ibuprofen, I have them take omeprazole, or commonly known as Prilosec OTC, and I have them take that first to calm their stomach before they take the ibuprofen. Also, if they can't take ibuprofen, I possibly prescribe them another anti-inflammatory that they can take, which for some people is something called Medrol. Speaking of fillings and cavities, before I go on to other causes, you need to watch my best daily brushing and flossing routine video. It will show you how to optimally take care of your teeth with all the best products that I have tested out in other videos that I've made. These products include my favorite toothbrush, floss and toothpaste by far. You can see why they're my favorite with the stunning results in a video that will pop up at the end of this video. I will also show you the best techniques in that video. Let's move on to another pain mechanism that might be set off by a filling that's much like pulpitis. This is called dentin hypersensitivity. Let me explain to you the mechanism of hypersensitivity, which will help you understand the rest. If you remove the enamel layer of your teeth and looked at the underlying surface of the tooth under a microscope, you would see all these small tubules. This layer under your enamel is called your dentin. Under a microscope, it almost looks like a wall with a bunch of PVC pipes in it. These tubules are filled with fluid and are connected to nerve endings toward the center of your tooth. When the dynamic of the fluid in those tubules changes, it sends a sensitivity or pain signal to your brain. The more of those tubules your teeth have, and the wider their diameter is, the more likely your teeth will become sensitive if those tubules are exposed. So what changes the fluid dynamic in the tubules so that they send sensitivity signals to your brain? Well, cold could cause dentin hypersensitivity. Also, sugar or simply touching the dentin can be sensitive as well. Now, if you have a filling, the dentist normally drills down to this dentin layer. So it is possible for anyone with a filling to develop dentin hypersensitivity. How bad that sensitivity just depends, like we just explained. Applying cold to the tooth is how dentists test and differentiate between pulpitis and dentin hypersensitivity. If the tooth is sensitive to cold and it lasts less than 3 seconds, it is likely dentin hypersensitivity. Otherwise, it is one of those other forms of pulpitis. A lot of times how intense the hypersensitivity is depends on how wide the diameter is, once again, how many of those tubules you'll have. But 3 other things can affect the dentin hypersensitivity at the time the dentist works on the tooth. First, the deeper and wider the filling is, the more likely it causes hypersensitivity. Second, if the dentist doesn't use an adequate amount of bonding, or if the bonding doesn't set right, you are more likely to have sensitivity. Third, dentists have desensitizers they can use before bonding a filling into place that reduces sensitivity. You may think, great, then everyone should do desensitizers. However, desensitizers can affect how well the bonding works of that filling. So there is a small trade-off there that each dentist has to weigh if they're going to use those desensitizers or not. It should be noted that a dentist can do everything correctly and you still develop hypersensitivity. In my practice, I make sure to keep fillings as small as possible and thoroughly bond the fillings. Then, if a patient still has hypersensitivity after trying the ibuprofen protocol for a few days, I will redo the filling with a good amount of desensitizer. Sometimes just redoing the filling will help. Of the small number of patients that develop sensitivity after a filling, I'd say more than 95% improve with these steps alone. Moving on. Another mechanism of pain from fillings has to do with stress on the tooth. When we do a white composite filling, it is a doughy white resin that we pack and mold into place for the filling. We then use a light to set or cure it into place, which bonds it and makes it firm. The thing is that when the filling sets, the resin shrinks about 1 to 5%. This shrinkage can pull and put stress on the tooth, causing an odd sort of biting pain. Normally, this is pain that only comes when biting just right or in a certain direction, so that's how you can differentiate it. A dentist can minimize the chance of this happening by adding the filling in layers or using something called a bulk fill layer before the top layer. In my practice, I like to use the bulk fill layer. However, sometimes you will just get unlucky as a dentist and as a patient, as this will happen to your patient anyways with the dentin hypersensitivity. Normally, redoing the filling due to pain caused by stress on the tooth is the best option here. But sometimes just filing down the filling will release the pressure and then the tooth will just get better that way. The next possibility to pain due to the filling is the inflamed tooth ligaments. You see, you have little ligaments that anchor your teeth to your jawbone. If too much pressure goes on those ligaments, the tooth can become sensitive and painful when biting. Unlike the bonding stress on the tooth we just explained, the biting pain with inflamed ligaments will likely be pain in any direction you bite. You may have noticed that the dentist had you bite on a piece of paper like carbon paper at the end of your filling appointment and asking you if the tooth feels even or normal when biting. We know it's hard to tell when numb, but we're doing our best to make sure the filling isn't too high. If it is too high, the tooth will take more pressure than other teeth and the tooth ligaments that hold the tooth in place will become stretched, bruised, and painful. Luckily in this case, case, the solution is simple, as the dentist just has to file down the filling a little bit so that the bite is more even. But one thing that always surprises me is how this happens with people not even realizing the tooth feels uneven at all. They just notice the pain. Then what I'll do is I'll file down the filling and the patient will notice, hey, not only does that make my tooth feel better, my mouth feels more even, and they didn't even notice it was uneven to begin with. So the main point is a high filling can cause tooth ligament pain. Let's move on to the mechanism of gum irritation. When us as dentists work on the teeth, sometimes your surrounding gums take a beating to help us accomplish the filling. And this is normal. This normally manifests as just a soreness to cold pain, and everything will heal up nicely. And while it is a general pain most of the time, sometimes there can be biting pain associated with it. Normally it heals up on its own, like I said, within a few days. In the meantime, clove oil or something like Oragel will help with this pain symptom. But there is another type of gum irritation with fillings. Sometimes a tiny hidden piece of filling or the bonding that we talked about pokes out just a little bit into the gums. For how tiny this piece can be, it can be very painful, like a pebble in a shoe. Normally, if you have gum irritation to something poking into the gums, this biting pain increases in time, and it doesn't have that cold pain, and that's how you can differentiate it. And it is really sensitive to the touch or even to just floss the gums there. The fix in this case is just finding where that little piece is poking out to, because most of the time they're imperceivable by just looking at it, and then smoothing the filling or whatever it is off. But you'll likely need to be numbed for the quick adjustment because it is pretty painful in the area if that happens to you. Now, this happens more commonly on white fillings and fillings on the cheek side of the tooth, because these fillings are ones that normally extend below the gum level. Another gum irritant can come if the new filling is trapping a lot of food when you eat. This happens because the filling was done in between the teeth and the new filling doesn't butt up tight against the tooth next to it. If this happens, you'll notice a lot of pain when you're eating because you're getting a lot of debris coming out when you floss your teeth. Now, a way you can tell if the filling is adequately contacting or butting up against the adjacent tooth is if the floss snaps through your teeth when you floss, as opposed to the floss just kind of gliding right through without any resistance. However, even tight filling contacts can sometimes still catch food. If this happens to you, you will likely need to redo the filling and make it even tighter. In the meantime, you can remove as much debris as possible by tying knots in the floss and then snapping the floss through and threading it back and forth until a bunch of the food comes out, and then snap the floss back out of your teeth. Now, one important thing to know is while you may be having pain, the filling was still likely necessary to do if you had an honest dentist. And I like to think and hope that most dentists are honest. You see, cavities normally don't cause pain until they get really big. So at some point, if you left the tooth untreated, it would have caused pain anyway and other bigger and more costly problems. Unfortunately, the best dentists in the world cannot avoid all sensitivity issues. But a good dentist will be able to minimize the probability of it happening, evaluate which of these pains you are experiencing, and then resolve the issue. So did your dentist do something wrong? Most dentists that I know have your best interest at heart. I suppose every profession has its bad apples, and I guess it would be possible. I hope not. Luckily, you'll be able to tell which kind of dentist you have by just simply going back to the dentist and giving them a chance to remedy the situation. Everyone should watch my best daily tooth care routine video I have posted now, and I will show you why it is the best with the best techniques and products. This video is part of a larger series of oral pain that I'm doing, so you can match up the symptoms we talked about here and watch more videos on a possible diagnosis and treatments. That way, you can further narrow down and find the cause of your pain and hopefully find a remedy and a dentist that can provide you an official diagnosis and treatment. If in Southern California, my dental office is linked to below. Like and subscribe if you have teeth.